Ladies and gentlemen, please stand for the national anthem.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Welcome to CMSA's 28th Annual Conference and Expo, We Are Case Management. This afternoon, CMSA's National President, Dr. Mary McLaughlin-Davis, will share more about why she's proud to be a case manager and part of CMSA. Today's keynote will empower you to take control of your health with the simplest of lifestyle changes. You will leave feeling motivated and inspired after gaining tools to not only improve your health, but also your life. Ladies and gentlemen, please welcome to the stage CMSA's Executive Director, Kathy Frazier.
Hello, hello. Good to see everybody here. Isn't this the greatest room? I love this. We're going to be so spoiled. We must have stadium seating everywhere we go. So I want to then introduce our fabulous sponsor. Fran has been sponsoring our main session event for as long as I can remember. And so with no further ado, let's bring out Fran. We can't do any of this without our sponsors.
I'm back again, and I'm here with the challenge. I'll once again tell you that I work for Sanofi Genzyme, and I'm one of 50 case managers that works with people with rare diseases and ultra-rare diseases, the lysosomal storage disease group. And I'm really proud to do that job every day because I love being a case manager. And I'm fortunate today to be with 5 of my colleagues. Where are you, colleagues? I can't see. And to learn more about case management in biopharm, I invite you to booth number 737 tonight at that wonderful opening reception. So one of the reasons that Kathy and the group invite me back is because Sanofi Genzyme really sees the importance of being a corporate partner and also being a corporate sponsor. One of the things that I challenge you every year is to be that catalyst, to go back to your leadership and to help them to understand that this is really the organization that represents each one of you. On a day-to-day basis, you have an opportunity to have educational programming, you have resources at CMSA, and also with their partnerships with other groups and organizations. So that's my challenge. It's like passing the torch. Will be the Olympics of case management. So go home. And then I also want to give one other shout out too, because this group, like each one of your chapters, does a magnificent job, and that's the Case Management Society of New England. Where are you, girls and guys? And I know that I could get up here and talk about each one of your chapters, and you'd all give a shout out for them. So once again, try to help your organizations to understand it's important to represent you and your colleagues at work, and to keep on supporting the Case Management Society of America. Thank you so much.
Thank you, Fran. Our next speaker is our very beloved president, Mary McLaughlin-Davis, and she will be coming out to talk to you, and I'll start crying because I know this is when she'll be stepping down at the end of the week, so we're not there yet. But one of the most amazing, amazing presidents we've ever had. I just can't say enough about her. Also, real quickly, all y'all way in the back, there's lots of room here. You'll want to be closer for Dr. Stork's presentation. Y'all can move down. He'll be walking around, so these are fabulous seats. You maybe couldn't see them. If you want to, that would just be my little suggestion. Mary McLaughlin-Davis.
CMSA's national president, Dr. Mary McLaughlin-Davis, has been described as a brilliant, well-spoken, caring, selfless, and a passionate advocate for CMSA and case management for all the right reasons. As her 2-year term as president comes to a close, Mary is ending her journey as she began, with a commitment to her CMSA colleagues and members. Mary reflects on this journey with CMSA and commends the national and local leaders, both on boards and committees, along with the support of staff for their hard work and dedication, creating strong relationships across the continuum of care and increasing education across the country. A few highlights of Mary's service to CMSA as president include building a strong collaboration relationship with the Commission for Case Manager Certification and with the American College of Physicians Advisors. These relationships contribute to CMSA's strength and scholarship, along with developing an advisory committee to clarify the relevant features of a conceptual care coordination framework for acute inpatient care that aligns with the recommendations of the Agency for Healthcare Research and Quality and the National Quality Forum. Additionally, Mary rallied several thought leaders into a task force to gain insight on staffing ratios for further research in this area. During Mary's presidential leadership, CMSA worked with interprofessional teams to increase the services, resources, and education to CMSA clients and their patients, including the military men and women. Mary has worked diligently to fulfill one of her goals, to bring the past presidents together, tapping into their expertise and insight of both CMSA and the industry. CSMA added another member journal, the Journal of Care Management, along with the current publications CMSA Today and the Professional Case Management. CMSA launched updated courses on the standards of practice and integrated case management. CMSA revised the Case Management Model Act, launched an opioid use disorder case management guide and celebrates a partnership to bring CMSA members the course Motivational Interviewing. Mary is very proud that CMSA resumed Military Day at the 2017 conference and continues to recognize the heroic men and women of our Department of Defense and Veterans Administration. Mary's Board of Directors also fully embrace the restructuring and rebranding of the Foundation and are working to enhance the collaboration between the two boards and organizations. All of this could not have been accomplished without the support of not only the Board of Directors, but of her loving family. And finally, Mary's proudest moment over the last 2 years has been the opportunity to serve and support you. CMSA case managers ensure the safe, seamless, and secure care coordination of patients and clients across all levels and types of health care. We are Case Management. Please give a warm welcome to your CMSA President, Dr. Mary McLaughlin-Davis.
Wow. What a great audience. Let's give ourselves a hand. I can't thank you enough for attending the conference this year. For anyone who's here for the first time, please raise your hands. I promise you, you will not be disappointed. You will learn so much, but most importantly, you'll form some lasting relationships. And what I've learned about CMSA is that it is all about the relationships. It's been such a privilege, a real privilege, to serve as your president for the past 2 years, and it just went like a flash. But none of us can do any amount of work without a team. And I had a great team, and I really want to recognize my 2016 and through 2018 Board of Directors. So can you all please stand? We also had an amazing group of support from Fraser Imagineers, our management organization, and I'd really like them to stand so we can recognize them if they're in the audience. And if they're not, let's give them a round of applause. Either way. Again, they have provided us with wonderful friendships and relationships through their hard work and dedication to all of us. You know, we all know that volunteering is a hard job, and that's what our organization is. It's a volunteer organization. But we couldn't do it without the support of our families, right? I have a wonderful husband who has done so much to support me with CMSA, and he is always been on the sidelines. He came to one conference, but he stays in the background, and he just helps me do everything and helps me, you know, do my day job, as Kathy said, and then helps me so much with CMSA. So I know you all have those people in your lives, and it's because of your relationships with them and because of their belief in you that you're able to do what you do. And so for me, it's been my husband and my children, and they have, you know, I just have to recognize what they've done for me. Now, we are in what a just wonderful city, right? Chicago, yay. Eric Bergman and his CMSA chapter have done so much to make us welcome and to help us navigate this beautiful building, navigate the city. So I'd really like the Chicago chapter members to stand so we can thank you and recognize you. Again, it's all about our relationships. We could not just land in a city and be totally effective without the help of the home CMSA chapter. Like I said this morning, CMSA has had a long history of supporting our military men and women and those who support them. We had another very successful military day yesterday, and we want to, really recognize our active duty, our veterans, and all those who serve both active duty and veterans. So could you please stand so we can recognize you and thank you. Now more than ever, we're all very aware that the military, as they're coming home, really need case managers as they transition from active duty to veterans care, from disability to work. They need our support, and they need a strong, viable case management system to help support them. So wherever you can lobby for that at the local, state, or national level, I really ask you to do that. We really need the support for our military and our veterans. And again, it's about the relationships and what they've been willing to do for us. Last year I mentioned that early in my career, I worked here in the Chicago area. I worked out in Wheaton at Marion Joy Rehabilitation Hospital. And I just wonder, is there anyone from Marion Joy here by any chance? It was a great experience, and it's really where I learned about team-based care and patient-centric care. And it was before fax machines. Truly it was. And my job was that I drove around the city and literally assessed patients to see if they were appropriate for acute rehabilitation care, and then so they could transition to Marion Joy. And I learned so much from that team-based care where acute rehab, everyone talked to the patient and believed that the patient was going to be able to recover, and they often did. It was very inspiring work. The first part of my career was involved also with public health, so that I was invited into our patients' homes and learned what they were up against, learned what they had to deal with. And again, it was before electronic records or electronic anything. I had index cards where I wrote my patients' names on each index card, and I had a big index card for the family. But again, I learned so much from my patients and from the organizations and the teams that were trying to support them. And we couldn't do it without believing in each other and having those relationships. Everything we do involves trusting and having the relationship with each other. The second part of my career, I've been very blessed to work for a world-class organization, the Cleveland Clinic. They have really allowed me to grow as a nurse, as a case manager, as a leader. They've taught me so much. They've supported CMSA, and CMSA has supported work with the clinic. So I know I have a number of my colleagues from the clinic here. I'd really like you to stand so we can recognize our great organization. Cleveland also has a very new chapter, relatively new, I guess. So the year that we had conference in Cleveland was the year our chapter started. And we had, so we were very busy that year. And we, like all of you with your chapters, we were struggling to figure it out, plus get ready to host CMSA. We had great support from our Cincinnati chapter. So I have to say, please stand, because I want to recognize our Ohio chapters, Cincinnati and Cleveland. Again, all about relationships. Our members are the backbone of CMSA. And I'm reminded all the time of how important that is. And when I listen to our members say, we're having trouble with our chapter, we're having difficulties getting people to attend our meetings, it feels so good to be able to reach out to a chapter that had the same struggles and say, why don't you talk to this chapter? Because they had those issues and they found ways to solve it. And always, 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 that chapter has been so willing to say, yes, we want to share. We'll help you. We're here for you. We're in this together. This was demonstrated to me like this past year. It just kind of knocked me over in a way. I had mentioned last year that I worked in Erie, Pennsylvania for a relatively short time, about 3 years. And it, again, was just when case management was starting to become recognized. But there was a group of workmen's compensation case managers in Erie, PA, that helped me, taught me, helped me. They showed me what to do, and they taught me about case management. They took me to a conference. They explained what the goals were for the patient, how they worked with the patient, how they worked with the physicians, the doctors. They showed me how assertive they could be. I was kind of used to the hospital hierarchy, and for them that didn't really exist if they were advocating for their patients. And I formed great relationships with these people. But you know how it goes. When you leave, you all promise to stay in touch and write and all those good things. And again, it was really before email. So writing was a little more of a commitment. And we were all busy, so I lost track of them. Well, this year, I received an email from one of them, 25 years later. And Debbie said, oh, Mary, I've been following you at CMSA, I'm still a member, and I have this quadriplegic that's aging. His injury is 30 years old, and now he's having some real difficulties. I'm wondering if you have anything in Cleveland that might help him. I can't tell you how much that meant to me. One, that I knew we could help her, but two, that after all that time, she reached out like it was yesterday, and we were joking back and forth like it was yesterday. And it just really reminded me again, and what CMSA has done for me is opened all the borders. I mean, we have colleagues internationally, so we can all reach out to each other and say, hey, I'm in rural Tennessee, but is there anything in your city that might be able to help my patient? I'm working for the VA. In the VA network, is there someone that has run across this problem? Or do you have a back line for that person I need permission from to help this veteran? Or, now with choice, I have a veteran. Do you have something in the private sector that will help his or her particular problem? And that's what CMSA has to give us as members. We have that connection. We have that global relationship. We have our new strong collaboration with CCMC, and now our American College of Physician Advisors. So I know that we are becoming even stronger and more varied in our interprofessional approach to case management, because we truly work across the continuum. But again, if we don't have the relationships, none of it would work. Any of us can, Google a name and make a phone call, but having the relationship is where people say, I'm going to help you. I'm going to drop what I'm doing and help you. And they're going to take your story about your patient to heart and work as hard as they would if it was for their patient. We can't do any of this alone. We have care partners here. They're going to be in our expo hall. They help us with services, products, everything from software to home care. And I really encourage you to engage with them. They're setting up their booths now, and they're so excited to be here, and they're so excited to meet you. And they have a lot of good stuff. They have a lot of good stuff for our patients. So think about it. Think about, how you can utilize their services. Because from day one, the case managers in Erie, PA told me, you have to work for that patient. So you can't just say, well, I have to take it to my boss. Well, you do, of course. There is definitely a chain of command. I don't want any of you to get fired. But we have influence. We are persuaders. We are professionals. So we know if something is right for our patient, and if it's not in our network or it's not in the supply chain, go to bat for your patient. Work with your vendor partner if you really feel and they have demonstrated the value of their product and that'll help the patient. Take it to heart. Fight for your patient. You do have clout. Again, it's all about relationships, because if the partners that we collaborate with they also have standards and values, and they want very much to bring those to the patient. But, I think most importantly, we want to think about what our work is. What is case management? The big question. But what is the reason for our work? And it is for our patients. That's what we're here for. That gives us our reason to be. And it's such a privilege and such a unique position to have that be our job. That's our job. We help patients get what they need till they can fire us. And we want them to fire us. We want them to become independent. We don't want to have to carry them forever. And so many of them have just undergone so many obstacles and suffering. We can't even truly know, but we can make the difference for them. we actually do have the gift of time often that maybe some of our direct caregivers truly may not have. And that's sad, but it's true. So we do have the opportunity in the emergency department or on the telephone or in the hospital or in the clinic. We in the veterans' home, we have an opportunity to make a difference and to alleviate some of that suffering. And we have an opportunity to build a relationship with patients, and that is really a sacred trust and really a profound gift. We can listen to what their goals are that might have nothing to do with losing weight, stopping smoking, going on a low-salt diet. They may not want any of that, but they know they want something. So when they tell us what they want, it's our duty to translate their goals into a health goal. So we can both meet our needs, but listening and then just having that relationship with the patient is really, I think, in my view, the most important gift that we are given in this work. We need one another. I've mentioned that. We need the resources that we all bring to CMSA. And I really encourage you at this conference to meet someone you don't know. And if you're here by yourself, sit down with someone, start a conversation. Case managers usually don't have a problem with that. We like our work for a reason. We are a fairly assertive group. And have fun. This is a very fun conference. So you learn a lot. Your head kind of explodes sometimes. Your bottom gets tired from sitting. And in this case, maybe from walking, our legs are going to get tired. But just enjoy it. Enjoy it. Gather as many business cards as you can. And I know that for myself, for Kathy, and the entire board, we want to meet you, approach us, talk to us. We want to hear your ideas, your concerns. And we're just, we're here to serve you. And we want to develop new relationships. So thank you so much. I really appreciate having the opportunity to be in this awesome position. And I really appreciate all of you. Thank you.